Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others around the internet. In the last episode of Know Your Mind segment, we spoke about nature, symptoms, and consequences of social communication disorder. In this episode, we consider causes, diagnosis, and treatment of social communication disorder. Causes of social communication disorder. Researchers have not identified any specific causes of social communication disorder, and so currently they are not known. However, researchers have found that a child could have higher chances of being affected by social communication disorder if there is a family history of autism, other communication disorders, or specified learning disorders such as impairments in reading, written expression, mathematics, and the like. Hence, social communication disorder can occur either alone or along with language disorders, speech sound disorders, childhood onset fluency disorder or stuttering, or other unspecified communication disorders. Diagnosis of social communication disorder. Experts recommend that the parents wait until their children are 4 or 5 years old before they seek diagnosis for social communication disorder. This is because though the children with social communication disorder show symptoms in early childhood, they are not often noticeable earlier on. Symptoms of social communication disorder become more perceptible only as children get older. Since the affected person's difficulties with pragmatics of language and social understanding become easier to spot as kids enter more complex social situations. Before the diagnostic process begins, medical doctors must rule out other neurological disorders and medical conditions that impact speech, such as intellectual development disorder, global developmental delay, or another mental disorder. When the affected persons go through medical examination and the above said conditions are ruled out, a speech language pathologist takes a medical and behavioral history and finds that the clients have difficulties with the following verbal and non-verbal communication skills. These include trouble sharing information and responding to others, difficulty to understand implied meanings, problem in the way they communicate in different social settings and with different people, difficulty understanding gestures such as waving or pointing, trouble taking turns when talking or playing, problem speaking about emotions, difficulty staying on the topic, difficulty using words for a variety of purposes such as greeting people, making comments, asking questions, making promises, and the like, and trouble making and keeping friends. If these symptoms are found in the client, the speech language pathologist takes the medical and behavioral history of the patients, collaborates with parents and teachers, and performs several diagnostic tests. Screening for social communication disorder includes interviews and observations, hearing tests, and questionnaires to determine an accurate diagnosis. With the help of these tests, medical and behavioral history of the patient, and the support from parents and teachers, the speech language pathologist is able to diagnose the extent of the client's condition and propose a treatment plan specific to each patient. Treatment of social communication disorder. Social communication disorder can impact not only the affected persons but also their whole household. Hence, parents and teachers of the affected persons need to work with a speech language therapist to help the affected person learn strategies so as to reduce the impact of this disorder on their social life. Treatment approaches for social communication disorder may include: first, augmentative and alternative communication using words, pictures, drawing, objects, gestures, and technology devices to help children, especially those who have trouble with words, to communicate better. Second, video-based instruction. Stories told through video can be an engaging way to demonstrate social skills and promote social understanding. Third, comic book conversations. Stories told through comic book show conversations between two or more people can facilitate better communication. Fourth, social skill groups. The speech language pathologist hosts group of 2 or 3 children and uses instruction, role playing, and feedback to teach social skills and work on communication. Fifth, social scripts. Scripted prompts are provided to teach children how to use language during certain social interactions. Over time, children learn to use them spontaneously. Sixth, social stories. Books and stories are used to explain social situations, promote problem solving, and help children learn behaviors and responses that fit the social situation they are in. Seventh, playing games. Playing teaches boundaries and how to wait for your turn. During game, ask open-ended questions and promote conversation. Eighth, speech pragmatic training. This practice teaches the meaning of idioms and the appropriate use of greetings. Ninth, having visual aids. When those affected by social communication disorder find it difficult to verbalize how they feel, they may be helped to communicate using pictures, toys, or props. The work done by speech language pathologists through these therapies, either in one-to-one or group settings, can be supplemented by parents and teachers in the home and school settings. Some of these activities include: first, taking turns. Participating in simple turn-taking activities that mirror the flow of social interaction. Second, read and discuss. Reading a book with a child and asking encouraging open-ended questions. Third, talk about feelings. Reading stories that can trigger talking about feelings and extending this to real-life situations. Fourth, what next? Let the children listen to your story and try to predict what will happen next in the story. This can help the affected persons to locate the clues, work backward of an event, or figure out the clues leading up to the initial stage of the event. With support, time, and patience, the affected persons can learn the social skills needed to help them successfully communicate and engage with others. Understanding the causes of social communication disorder, getting diagnosis on time, and following the specific treatment plans suggested for you by the speech language pathologist on a regular basis, you can manage your social communication disorder reasonably well. In the next episode, we will begin our analysis of voice disorder in detail. Thank you for watching this video. Stay blessed until we see you again with another video.